The current users of Seton House regularly frequent drop-ins, medical centers, harm reduction supports, mental health supports, and hospitals, often by foot, and many have a community in the city core, which I think goes against what Mr. Tanner said. We therefore ask for a detailed plan that ensures that any new shelter beds will only be located in settings that offer the full range of health and social services necessary for this complex population with the same expertise and access as is currently available downtown. Now my question, if I may. I'm going to direct it to Mr. Tanner, although anybody can answer. With all these experts on the subject of homelessness, housing, and services for the vulnerable demographic that we're discussing, who strongly oppose moving shelters away from necessary supports, the professionals, what services do you feel, Mr. Tanner, the area around 731 Runnymede Road has to offer? And I live 3 blocks away. Thank you.
So thanks for your question. With respect to the 100-bed shelter that's proposed for 731 Runnymede Road, as I mentioned, the services that were provided there will not be the intense kind of supports that the doctors are referring to in the letter that you made reference to. The supports in the local neighborhood with respect to partnerships that we will build on and develop with service providers already in wards 11 and 13 includes such places as Sunwater Neighborhood Center, Unison Community Health Center, Four Villages Community Health Center. The issue there is actually Community Health Center do have a specific fund from the province that provides health care for homeless people, and that's in every community health center. So I do understand that there are challenges getting doctors in this community. I'm not trying to dispute that at all. There is special funding that goes to the CHCs to provide access to health care for people who are on the street and homeless. So those are a few. Some of those would be accessed by transit. They're not all walking distance. Folks that come into our shelter system, we're trying to get back into housing. People need to know how to use the transit system. We provide a lot of tokens to people to get to services all over services in the community.
So the map that was at the last meeting, the one that showed our services available in Ward 11, is it somewhere on that wall?
Yes. I'm saying yes, I'm assuming it is, yes.
I'm sorry, I just want to know if it's on that wall. That's all I want to know.
Emily. Yes.
Thank you very much. I appreciate that.
I just want to address the councillor who spoke about the in his writing, and councillors always seem to reference the 4 people that died on the street last year. I held the hand of a shelter user who died 6 months ago. With the numbers that they don't tell you is that 45 people died in the shelter system last year, most of them men with a median age of 58. And so what the city needs is not extra shelter beds, it's not what's saving people, it's the poverty reduction strategy and affordable housing. Okay, I first wanted to thank you for posting the map of the community resources, which you've also brought tonight. Last week at our meeting, it really it showed that you're trying to address the concerns of us being a priority neighborhood and in Rockcliffe Smythe not having a lot of resources and services, and our trepidation that we would not be able to provide adequate services to support the 100 men using the shelter. And I see the map was created by SSHA in April 2016. Was it created for this specific project?
We have a database of all of our funded programs. It's a matter of printing out a report and then populates it on a map.
Okay, but you didn't actually survey the neighborhood yourself.
Excuse me. We fund services in every community across Toronto. We have staff on the ground at each one of those agencies that actually receive funding. Just so we're clear.
Okay. So, and the maps that you're referring to that are posted, is that what you use to choose the shelter location based on the availability of local resources? So I reviewed the map and I was able to learn a lot about my neighborhood. I had no idea we had an Islamic Social Service and Resource Association or a sexual health clinic that was open for 15 hours a week. I do have some concerns about the map. First, there are a few addresses that I'm particularly confused about. The map lists 5 Foxwell Ave, which is a single home that just sold for $720,000. The next is 29 Cynthia Road, which is a home at the end of a dead-end street. Then there's 1570 Jane Street, which is a low-rise apartment building. And most confusing is 301 Rockcliffe Boulevard, which is just an empty field. I have pictures of these for your reference. How do these addresses So you also identified 7 child care services in schools. I'm wondering how these are going to be relevant resources to the men experiencing homelessness in our ward.
So these are community resources that are plotted on a map with respect to a whole range of different social needs, including child.
So my next one, and probably the scariest one for me when I noticed it, was that one of the most relevant resources on the map that you provided is the Sim-Woolner Neighborhood Association, which would address the primary needs of the people staying in shelters, the ones we heard that Mr. George needed, and the ones that the healthcare professionals were talking about. And it does have services such as harm reduction equipment, drop-in services, meals, clothing banks, and social recreational programs. Unfortunately, Sim-Woolner Neighborhood Association has 2 different offices, and your department placed the relevant service in the wrong neighborhood according to the map. Sim-Woolner Neighborhood Association that works with homeless is actually at Islington and east of Peel, and a 1-hour walk from the proposed shelter site, not in Rockcliffe, Smythe, as shown on your map. Sim-Woolner Neighborhood Family Center, which is in Rockcliffe, Smythe, which is conveniently located on the map that shows services around our ward. That's actually located in Georgetown Elementary School, and they provide preschool services to newcomers. I have several other examples of resources that are relevant and do not address primary care. I should have made myself more clear at the beginning. I was concerned about the lack of relevant resources, not relevant ones. I have made a comprehensive table of the resources you listed, the walking transit duration, and what services the agency provides. I'm not even going to bring up the placement of the services on the map because it's all out of whack. Considering that SSHA put irrelevant research on the information link provided to the community about the impact of shelters on communities, which was addressed in the first meeting, you said yourself that there was no research in the area, therefore it appears that the city made a false claim on their own information bulletin. And considering all the inconsistencies in the map you provided the public and possibly used to assess the services in the area and false information, I do have to ask, is SSHA deliberately misleading the public, or is there some sort of incompetence in the department? Rockcliffe Smythe community or homeless men any reassurance that you've done your due diligence in considering their needs and selecting an appropriate shelter site? Or were you hoping that the working class neighborhood with their low education rates we're weren't going to notice?
That's right.
I'm also developing a new map with the relevant resources that I can show you because it's actually very striking. Thank you. Were you misleading the public?
So this is the 3rd time we've come and asked all a series of questions at each of the 3 meetings that we've had. What I'd like to do is really thank you because you've done a lot of them, and you have. And it's absolutely, you have done a lot of research, and that's very helpful for us. The answer to your question, though, is we have done our due diligence. We know that the services that do exist. We made it on that map. My apologies, and we will have to let you
Apologize to us, apologize to the homeless.
Before I move forward, I do have a few questions, so I'm going to ask one. Is there a process whereby we could ask to modify the recommendations to provide a larger lounge at the shelter with fewer beds? That is the question.
Okay, so the question is with respect to the number of beds on the site.
Quiet.
Number of beds on the site with looking at the property itself, the square footage it allows the shelter standards to put 100 beds on the site. The process by which, if this proposal is successful, we would phase in those beds over a period of time, likely a 3-month period. So there wouldn't be everyone showing up on the first day. Those beds would be open over time to accommodate some of the folks as they come in, and over time, the site can hold up to 100 beds.